Welcome back to Health Next. Today we are looking at ways of how to conceive a boy. It's not an easy thing to decide what you want because you're not God, but we have come up with some possible ways you can practice in order to conceive a boy. The first thing we are going to look at is when to have sex. It's all about a race to the EEG. Shuttles found sperm containing a Y chromosome were smaller, would swim faster and have a shorter lifespan than the sperm containing an X chromosome. It's believed that if a couple had sex around the time of ovulation, the male sperm would be more likely to reach the egg before the female sperm. If the egg fertilized, the couple were more likely to conceive a baby boy. Female sperm were found to be slower, fitter and would live longer than male sperm, so making love earlier in the fertile window meant they would still be alive to fertilize the egg, and more likely to conceive a baby girl. Whilst it's a fascinating theory, studies since then have shown that the timing of sex in relation to ovulation doesn't actually influence whether you conceive a boy or a girl too. Whether you are interested in conceiving a boy or a girl, it's still important to remember that there are only a few days in every cycle when you can get pregnant. Clearblue digital ovulation tests identifies your 2 most fertile days so you can be confident you are trying at the right time. And the Clearblue Advanced Ovulation Test typically identifies 4 or more fertile days, giving you more opportunities to get pregnant. You should mind about sexual positions. Shettles also suggested that the sexual position at the time of the father's orgasm may help the chances of conceiving a boy or girl. Deep penetration, for example doggy style, means the male sperm that can swim faster start their race closer to the cervix and are more likely to reach the egg first, resulting in a boy. To try and conceive a girl, Shettles suggested avoiding deep penetration, favoring the missionary position. It's another interesting theory, but again there's nothing to support this idea. Many doctors actually advises that there are no methods to affect the sex of your child, including sexual position, but you just have to give it a try. Another way to use is eating certain foods. Cervical mucus is most sperm-friendly at the time of ovulation, when it is more alkaline. Prior to ovulation, the mucus is more acidic, which is not ideal for sperm, and only the fittest can survive. Shettles suggested that making the vagina more acidic means the fitter female sperm are more likely to survive and a baby girl is conceived. A more alkaline environment is better for the faster male sperm and a baby boy is conceived. You could try different foods to influence your vaginal pH, but we haven't been able to find any evidence that this works. Thanks for watching.